Welcome to Barnstable Today. I'm Nick Cortez. When it comes to the stability of Cape Cod's year-round economy and the health of its population, the Cape Cod healthcare system plays a crucial role. With 2 hospitals, over 400 physicians, and 4,600 employees under its umbrella, Cape Cod Healthcare is not only the largest employer on Cape Cod, but in all of southeastern Massachusetts. Needless to say, running such a corporation is an enormous responsibility and a challenge, especially as the already complicated healthcare industry landscape stands to be altered significantly as a result of federal and state reform legislation. The man who's taking on the challenge is Michael Loff, who was recently installed as the president and CEO of Cape Cod Healthcare after his mentor, Dr. Richard Saluzzo, left the post in late 2010. Earlier today on Barnstable This Morning, Loff spent some time with us talking about his new position, the state of healthcare on Cape Cod, and the many challenges that lie ahead. I wonder if you could just start off by giving us a brief professional background and allow us to know how you came to Cape Cod.
Well, my professional background is diverse and interesting. I actually began my career working for a member of Congress. I was Director of Community and Economic Development for Congressman John Murtha in the early to mid-'90s and into the later part of the decade. At that point, transitioned into the healthcare field, was able to run smaller community health systems, as well as do a lot in the field of research, and began a research institute. Transitioned from that point into a operational role at larger tertiary type medical centers, trauma centers. Recently was Chief Operating Officer at the Wellmont Health System in Tennessee, as well as the Chief Operating Officer of Bristol Regional Medical Center, and then came in the Chief Operating Officer capacity to Cape Cod Healthcare in July of 2008. Was named President later last year, and then ultimately was very fortunate that the board asked me to become President and CEO following Dr. Saluzzo's departure.
Obviously, Cape Cod Healthcare is the largest employer in southeastern Massachusetts. It's very important to thousands of people here on Cape Cod for their livelihood and their lives, period. So what kind of system were you left, and what are the biggest challenges to keeping such a large entity that employs so many people viable into the future?
Well, Dr. Saluzzo was hired in 2008 by the board of directors, and he brought with him a comprehensive plan to change the financial and clinical approach that we had at the Cape Cod Healthcare had, and I was fortunate enough to be asked to join him here. We came at the same time, and Rich did a remarkable job, and not only himself, but the team that was put together that I was a part of, and so we hired a lot of good individuals. We partnered with our physicians. We reached out to community members, and we have the hospital back on solid ground. So he left Cape Cod in good shape, both clinically and financially. Operationally, we're very good at this point, and so I think we have a great platform to launch into the future to really focus on key initiatives like access, working with our physicians in a new physician healthcare organization, working to enhance quality at every juncture. And then how do we do that? We're also doing a full-scale IT implementation right now that will hopefully make the transition go well and enable us to share patient health information in a seamless fashion across our continuum.
Now, one of the big problems that we have here, talking about challenges, is a lack of doctors, especially primary care physicians and also some specialist type of positions. I wonder what your strategy is to recruit more good doctors, and not just recruit them, but keep them here for the folks who need them.
I think our approach is we need to understand who we have on our medical staffs, who we have in our community, then partner with those people to bring in new folks to help them, get them involved in the recruitment process. Secondly, it's recruiting the right physician that wants to be in the Northeast, that wants to be on the Cape, that has a tie here, because then you keep them. So whether it's a spouse or a relative, or if they vacationed in their childhood, it's an opportunity to recruit that kind of person. And then thirdly, when we get them here, how do we work with them to make sure that we get them involved involved in the community, get them to meet other people, other peers, because the system's changed. No longer do all the primary care physicians come in and stay at the hospital. Most times now, the hospitals are mainly made up of specialists, and we have hospitalists to take care of a lot of the inpatient work. So we need to do more to reach out and get all of our physicians communicating together, and also administratively, we need to do more to reach out to these folks to maintain their to hopefully maintain their presence here on the Cape.
How valuable is it to do just that successfully and have some level of integration between the primary care providers and the folks over at the hospital, considering what we might possibly see with the changing landscape of how health care is reimbursed by insurance companies?
It's absolutely necessary and vital, and that's why we've done two things this year. One, we recently launched, again, the new PO-PHO, in which we're integrating medically with all of the physicians across the Cape. Now, it's an independent group, so some want to be in and some don't. We're fortunate right now that we have 280 physicians that have said we want to partner with the hospitals to integrate our approach to clinical care and enhance quality. All to do what? To make care more efficient and promote, again, the quality outcome to get in front of the new changes in healthcare payment. Because access has been one thing, the change in payment into a more risk-based environment is another, and then we also are anticipating major changes coming from the new Affordable Care Act that was recently passed. Mm-hmm. And that's all going to make, that's going to ratchet down reimbursement on the governmental side. So we'll stand to lose about $106 million over the next 9 years for Medicare alone. Mm-hmm. Well, that's 60% of our payer mix is made up of Medicare patients. So we need to really provide excellent, efficient care if we're to compete long-term in this new healthcare arena.
Yeah, that was the question, picking up on that response there. What's the strategy to cope with federal healthcare reform should it not be blown up by Congress, and you'll have to deal with the reduction in Medicare payments and so on and so forth?
Well, I always laugh. You can whine all you want, but I always say the market's the market. So if they're going to take Medicare away and they're going to reduce our Medicaid payments, obviously, which we've seen, what are we going to do? Well, we have to go out there and make sure that our model works. So you partner with your physicians, you partner with your employees, and you work on process improvement. We try to refine process each and every day at the point of service where the employee does its job. So if you create the right partnerships, you get an efficient operation. It leads to great quality clinical outcomes, and hopefully that's good enough to compete long term.
Now, supposing that if Governor Deval Patrick's proposal to sort of reform the way that healthcare costs are reimbursed by insurance companies, going to more of a global payment rather than a fee-for-service system as it exists right now, I wonder what your thought is as to how the system will end up coping with that to ensure a high level of quality care, and then also how to cope with the possibility that potentially more malpractice lawsuits may result from maybe not having the reimbursement capability to run that extra test that might be able to diagnose disease X, Y, or Z.
Well, it's difficult. I don't know that the state has led the country in terms of creating access. But as you know, they haven't been able to fund the system entirely. Yeah. So we're seeing ratcheted, reimbursement that don't cover our costs right now to take care of patients. But, we're a not-for-profit. That's our role. We understand that. But now if you also then on the commercial side of the equation move everybody into a capitated or global type system, we say around here you can't have it every way. You can't give 3% raises. You can't see increase in medical supplies and device procedures. You can't recruit the best and the greatest physicians and then not be able to at least turn a small profit through the commercial arena. So there's a larger discussion that needs to occur. I don't know if the state necessarily has a firm idea where that'll end up. I know the federal government doesn't have a firm idea where it'll end up. And I think what we're trying to do is say, listen, what can we do to control our own destiny? Partner with our physicians, refine process right now internally, promote service to treat our customers and our patients extremely well, and then make sure that if we do all those things well, we'll be able to compete financially.
Remember, you can watch this complete interview and every episode of Barnstable This Morning anytime you want. Download and stream full-length Channel 18 programs online at town.barnstable.ma.us. Well, that's all for now. I'm Nick Cortez, and we'll see you next time on Barnstable Today.